Hello, 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 YouTube world. This is Miss Patti with For Your CNA, and this is our live weekly question and answer session where I answer all of your questions on CNA training and testing and workplace issues and whatever else you want to talk about while we're here together. Thanks for joining us. When you come in, if you can just leave me a quick comment in the chat, give me a wave, let me know that you're here so we can recognize you. And thank you guys all for joining me. I'm back home. Yay! There really is no place like home. I can totally relate to Dorothy in The Wizard of Oz sometimes. Vacations are great, work functions are great, but you get to a point where you really just want to be home. And I'm back home. Quick shout out to my husband really quickly right now. He put my new bookshelf together for me, so I've got something behind me to display all of my stuff and put everything within easy reach. So he's got a Husband of the Year award, so great job for him to put that together for me. He got it done literally minutes before we had to go live, so nothing like a little pressure, right? So I'd like to invite you to like and subscribe to our channel. Guys, we are so close. We are 1,000 subscribers away from our YouTube plaque. So if you haven't subscribed, do me a favor and subscribe so we can get that. I'm super excited, looking forward to it. This is a huge accomplishment, 100,000 subscribers, and it's all because of you guys. So if you've subscribed, thank you so much from the bottom of my heart. And if you haven't subscribed, please do so. If you've got any friends and family that would find this content helpful or useful or entertaining, ask them to come join us as well. So let me say hi to the people that are here, and then I want to give you just a really brief review of what happened last week. And I got a few things I want to say about that, and then get into today's lesson, and then we'll get to your questions. So Shakella Lang, hi. The Romeus family, hi, thanks for joining. Joanne Benoit, hello. And Shakella says, I'm proud to say I watched this last year and passed my state board. Congratulations, but I still watch. Well, thank you. That's what this is all about. We really wanted this weekly show to go beyond what we normally do, right? So we're most known for helping people with CNA training, so getting them ready for the test. And we've got the skills videos, and we have the animated videos, and we have the books, and I've got the ebook, and we've got the card game to make it fun. And that's really what we're known for, is that CNA training. But you guys deserve support way beyond what your training phase. And questions come up all the time that you're going to have in your workplace. Issues, and can I do this, and what does this mean? And we want to be here to support you beyond certification. And that's why I'm really excited to be here with you every single week, talking about these issues and helping to support you. And if nothing else, this is a little bit of time in your week where nobody's ringing a call light or yelling at you or on your case because you're moving too slow, or you feel overwhelmed because you got too many patients. This is the one time of the week where you can have a pat on the back and a smile and a good job to you. So we're really, really, really grateful that you allow us into your lives every week so that we can continue to support you beyond the training phase. So thank you guys for coming. Jennifer, hey, Jennifer. Jennifer says, I just want to say thank you for doing this every week for us. I appreciate you more than you'll ever know. Oh, thank you, Jennifer. I appreciate you, because if you guys weren't here, I would be standing here talking to an empty room, and I have done that, yes, absolutely. And I would still do this even if nobody showed up, because I love what I do. But it really is super special to me when I have those of you that show up every week, and you're here to support me as well. And I can't say enough wonderful things about you guys. You truly are my tribe, and I am so grateful to find each and every one of you. Alvaro says, love what you do for us. Oh, thank you. Hey, Blue. Sometimes I just want to be home. LOL. Yes, Blue. Absolutely. Sometimes home really is the best place to be. Hi, Priya. Hi, Wendy. Hi, Keisha or Keisha. Jennifer says, I called the Oregon Board of Nursing. They said that assisted living doesn't count as CNA hours, so it doesn't require being a CNA. But lots of my CNAs in my hometown that I work at, so I'm still confused. Okay, we'll get to that in just a few minutes, Jennifer. Wendy gets to watch the live. Yay! Welcome, Wendy. Blue says, as at a trade show I was at, I saw this contraception that takes one CNA to use. When a resident client falls, you place it on the floor, gently slide it under them, push a button, and it lifts a person up with minimal effort. Yes, I have seen those. They are amazing, and it really does help lift the patient up. But there's a downfall to that, and this is why a lot of facilities don't use them. First of all, the cost, right? Those things are very, very expensive. Any new tech is going to be very expensive, but the real problem here is that if we have something that allows a CNA or a caregiver to just get the patient up, there's nobody there to assess that patient for potential injury. And CNAs aren't allowed to assess. So what ends up happening is it increases the liability for the employer. So when you have a situation where a caregiver can't get a patient up all by themselves, sometimes we'll miss that whole assess for injury first step, and that puts the patients at risk. And I think that the tech is awesome. I think it's a great addition, but you have to have really, really good control over your staff to make sure that the patient doesn't experience additional injury beyond, because now they're able to kind of bypass the nurse. So that's very interesting. So let me talk to you real quick about last week. So that last week, those of you who tuned in know that I wasn't here. I wasn't at home. I actually went out to Las Vegas to attend a retailer uniform conference. So most of you guys know I have a retail uniform store where we sell medical scrubs, to healthcare workers. And we actually are the largest single store uniform store in our area. So we are considered what's called an elite retailer. So we were invited out to Vegas to participate in this, and it was a lot of fun. They put us up at the Venetian Hotel, which, oh my goodness, this place was amazing. It was a suite. There was a little living room. The views were to die for. It was just awesome. And a lot of fun. And I got to connect with other retailers. And sometimes it's nice to be able to talk to somebody that is in your industry, that kind of shares your pain points, that knows your challenges, and can help kind of give you some motivation on the bad days and help you celebrate the victories because they understand what it took you to get there. So it is nice to be able to connect with like-minded individuals that are in your industry. The problem is that we're all kind of competitors to one another. So you really can't connect with your local competitors because you don't want them to know all your secrets. So it really kind of is tricky to find just the right distance away where they're not really a local competitor, but close enough that they understand, your particular region and the challenges that go along with that. So it was very interesting. I got to connect with some fantastic retailers. I got to meet the head people of Charisma Brands, which is the parent company for the brands that you probably know, Cherokee and Dickies and Heart Soul and Infinity and Allura, Euphoria. I mean, they've got millions of lines. But Med Couture, Healing Hands, they're all made by the same parent company called Charisma Brands, or CBI for short. So we went out there, we met with them. I got to connect with the administration, got a lot of questions answered, got some really good ideas for marketing, and we're going to be bringing in some new lines. I get to meet with a sales rep tomorrow to write my orders. It's a lot of fun. It was a great, great, great time. There were a few things, though, that I took away from it. And I know we spent a little bit of time together last week, and I couldn't really get into your questions because when I'm on, all I have is my phone when I'm out in the field like that. And it's really, really hard for me to see the comments while I'm having the conversation. So I don't like doing things out in the field just because I feel like I miss that connection with you guys. I can't really see what you're saying. But there's a couple of things that that I wanted to kind of share with you about last week's meeting that I thought was kind of interesting. Some observations that I made. So we have, right, in healthcare, we have to wear scrubs. Now, sometimes your employer is going to tell you what color or what style or what brand. So sometimes your employers are very, very, very picky about what you're going to wear when you're representing them. And other times it's, well, just wear scrubs. We don't care what they are, just wear scrubs. And there's a lot of middle ground in between those two. But what's interesting to me is that owning a scrub store, when I first started in medicine, in nursing, you really didn't have a whole lot of options, right? Because I've been a nurse for over 30 years. So for me, it was, when we first started, it was whites. The only people that got to wear prints were those that worked in home care or in pediatrics. That was it. And that was really hard to get anything other than white. And then things changed and prints became a thing. And now we're back to solids. So everything kind of changes over time. But what's interesting to me is that way back when, you really didn't have a lot of options as far as styles, colors, price points. Everything was pretty much, these are your nursing uniforms, this is what you're going to wear, and that's it. Well, now there are literally thousands of different styles. And it's a good thing, right? Because not every body is shaped the same way. Some people can be an extra large, but they have bigger shoulders than hips. Some people can be an extra large and have bigger hips than they do shoulders. Some people can, be a 3X in the waist, but their hips are really narrow. So there are so many different body types out there that one line is not going to fit everybody. So when you're going out shopping for scrubs, the challenge is to find the line that fits you the best. And I hear this all the time in my store, all the time. I hear, well, there's no universal sizing in scrubs. Well, no, there can't be, because if it was universal sizing, that means that everything is going to fit you exactly the same. And in that case, why even have different lines? So your challenge is to find the line that fits you the best. For me, it's Infinity. Infinity fits me the very best, and I've tried them all on. There is a pant in Healing Hands that I like too, but Infinity really is my go-to. That's the one that I focus on because it fits me the best. Now, that doesn't mean it's going to fit everybody the best. It just means that that's my body type. This line fits my body type the best. And there's a reason that we have so many different lines and so many different styles within those lines. So when I'm meeting with a sales rep tomorrow, I'm going to be bringing in 5 new lines. Now, each one of those lines is going to have 2 or 3 different styles of pants, 2 or 3 different styles of tops, and we have to bring it in 7 to 9 colors. And, we have to have so many of each size. So you're talking about a whole lot of scrubs that I'm going to be ordering. So it's going to be very interesting to see how I'm going to fit all this in my store, obviously. But if you understand the scrub industry and understand that when you go into a scrub shop, if you just ask for Cherokee, they're going to look at you kind of funny, because that's like me walking into a car dealership and say, I want a car. Well, what kind of a car do you want? What's your budget? Do you want a 2-door or a 4-door? Do you want something that's going to fit a lot of groceries, or do you want something that's going to go really fast? So they're going to need a little bit more information from you. And don't be afraid to try stuff on. Take a whole bunch into the fitting room. Try on 6, 7, 8, 16 different styles, because somewhere in there you're going to find the one that makes you look and feel your best. And it's important to look and feel your best when you're out there working, because it is going to affect how you relate to other people. We talked about that last week as well. So keep that in mind when you're out scrub shopping, is that every single style out there is designed for a specific body type, and it may not be your body type. You've got to find the one that fits you the best. So I hope that helps you guys, but I wanted to kind of wrap up last week. Thanks for joining me. If you guys liked that format, if you liked me taking you along with me to that trade show, let me know. And maybe we'll do it again next year. If you didn't like it, if you rather keep to this format, let me know that too, because this is your show. I'm just here to talk to you. So I want to make sure that this is something that you enjoy. If you liked last week's format, let me know. If you didn't, let me know that as well. So, so today I want to talk to you. We're going to get to the questions in just a second. So today I want to talk to you about gloves. Now this is something, those of you who tune into my classroom live stream, you guys know about that. I live stream my classroom classes, every class period, onto YouTube. So we meet Mondays and Wednesdays from 9 to 1 Eastern time. So if you get an alert, if you subscribed and you rang that bell and you get an alert that says I'm going live, it's because I go live for my classes. And if you've tuned into yesterday's class, you'll know that we talked about gloves. And this is something that even seasoned CNAs get really confused over. And I have a whole lecture on that. Go back and watch the replay if you want to learn a little bit more about gloves. But I want to talk specifically, really quickly, about who those gloves are actually there for. And this is something that we kind of get mixed up in healthcare. So those gloves, we tend to think in healthcare that those gloves are there to protect us, because those patients have all kinds of cooties and ooey gooeys, and I don't want whatever they've got, because they're here wherever here is, hospital, nursing home, assisted living, whatever, and I don't want what they've got. So we tend to think of gloves as there to protect us from the patient, but in reality, we kind of have that backwards. Those gloves are there primarily to protect the patient from something that we may be bringing into the room to give them. So think about a hospital for a second. A hospital is full of patients that have all kinds of really bad things wrong with them. And those pathogens, those viruses and bacteria and yeast and fungi and all the bad stuff, those pathogens are easily transmitted from one patient to another by us, the healthcare workers, if we don't pay really close attention to what we're doing. And this is why we are responsible for washing our hands before we touch the patient and washing our hands after we've touched the patient. This is like critical. We have to do hand washing before and after all patient contact. Now, that may mean hand sanitizer. Make sure you're getting enough to keep your hands wet for 20 seconds to be effective. May mean hand sanitizer. It may mean actual hand washing. But at the end of the day, we need to wash our hands to keep that patient safe from all the other pathogens in the building. But it goes beyond that as well. Because if we are wearing gloves, let's say we're going to brush somebody's teeth, there's saliva, we need gloves. When we put those gloves on, they need to remain clean for the patient. If we put those gloves on and then we go get our supplies and we open the toothpaste and put the toothpaste on the toothbrush and we do all of this kind of stuff, and then we start brushing teeth, well, we've contaminated those gloves with everything that we've touched, and now those pathogens are introduced into the patient's mouth. That's not cool. So we need to pay attention to who those gloves actually are there to protect. They're there to protect us in a little way, but they're there really to protect the patient from all the pathogens that are in this place. Because when a patient goes to a facility, they take all of their germs with them. And it's really, really easy, if we're not watching what we do, to cross-contaminate and pass the patient something that they didn't come in with. So remember, both people in this scenario need protection. The healthcare worker, yes, but you've got a pretty decent immune system. But really, the patient is the one at risk. Their immune system is currently busy. If you bring another pathogen to that patient, they may not have the resources to fight it off. So we need to have a clear understanding in our mind who those gloves are there for. Now, the next question here that we have to be aware of is, where can I wear gloves? And this is going to go right back into what we talked about a minute ago. So if we're wearing gloves when we're working on the patient, when we're working on them, we've done all of our opening, we washed our hands, we got our supplies, we did all of our prep work, ready to go, put our gloves on and working with the patient. That's how it's intended to work. If you put gloves on out in the hallway and then walk into the patient's room, everything that you touch, the curtain, the door, the bed, the supplies, everything you touch is then being contaminated by whatever you touched previously. So we need to have a rule here that gloves are only worn during patient care, and that the first thing your gloves should touch is the patient. And then after you've performed that care, you need to be aware of what you're touching with those gloves in the environment to prevent cross-contamination. So gloves are a whole lot more complex than just a simple wear gloves, every skill, every patient, from the beginning to the end. And that's how a lot of people think about gloves. They walk in a room, they put gloves on, they work with the patient, they take the gloves off as they leave the room. And that may not be the right answer. And it's definitely not the right answer on the state exam, because those evaluators are looking for that cross-contamination component. So you've got to be super, super careful when you're wearing gloves as to what you're touching with them. Are they contaminated? Are you contaminating other surfaces? Gloves are going to introduce a whole new level of potential cross-contamination. So when it comes to gloves, there's a couple of very simple rules here. First of all, gloves are never, ever, ever allowed in the hallway, ever. So if you've got gloves on and you've got to walk out into the hallway, you must take those gloves off and wash your hands before you leave, even if you're coming right back. Let's say that you're doing a skill, you forgot a washcloth, you just have to run to the supply cart real quick and grab a washcloth. You cannot go out in the hallway with gloves on your hands. You've got to take those gloves off, wash your hands, go get the supply that you need, come back in the room, wash your hands again, re-glove, and resume your skill. And these rules are not time wasters. A lot of CNAs think that they are. A lot of CNAs think, that this is a dumb rule. Why do I have to wash my hands? Why do I have to take my gloves off? I'm just going to go, same patient, I'm just going to go get what I need and come back. But there's a reason behind it. Because everything that you're touching in the hallway, the door to the supply room, the supply cart itself, when you're reaching into that supply area with soiled gloves, you're contaminating things in that clean space. So we've got to make sense of this. We have to understand that the rules are there specifically to protect the patients. So gloves cannot be worn outside of the patient room. They also can't be worn when you're preparing to do a skill. So you got to do all of your prep work first. If the patient needs to be sitting up, you're going to do that before you put your gloves on. If the patient needs a towel on their chest, you're going to do that before you put your gloves on. If you need to put toothpaste on the toothbrush, oops, sorry, I thought I turned that off. If you're going to put toothpaste on the toothbrush, you're going to do that before you put your gloves on. So you've got to do all of your prep work before you put your gloves on. And then you've got to know exactly when to take them off so you're not cross-contaminating other things in the area. So there's going to be a point that you have to move from clean to dirty, and then there's a point that you have to move from dirty to clean. Those areas, those crossover points, is where most cross-contamination occurs. So be aware of that. Now, the reason I bring this up is because I've got a YouTube channel. You guys all know that. I have videos on the YouTube channel. You guys all know that too. But one of the videos this week got a comment. Somebody said, don't you put the gloves on before you go into the room? And the answer to that is no. We're not allowed to put gloves on in the hallway. And we have to do a whole bunch of stuff before we can even get to gloves. You've got to knock. You have to identify your patient. You have to introduce yourself by name and title. You've got to describe the skill and get permission. You've got to close the privacy curtain. There's so much stuff you have to do. And then you have to go wash your hands. If you walk in with gloves on, you're not doing any of those other things. Or if you are, you're cross-contaminating. So it's really, really important that we understand the right order for this. So what that tells me is that somewhere along the way, that particular individual was told by an instructor the wrong information, and that can derail you during testing. And I see this a lot. Just because somebody is an instructor doesn't necessarily mean that they understand the test or they understand basic nursing practices or that they were even trained properly. So be really careful here and make sure that what you're being taught is lining up with the clinical skills checklist, the thing on Prometric's website that you're being graded on. So I hope that helps you guys understand a little bit more about gloves, when they're used, when they're not used, and why there's specific rules around gloves. And those rules are really there to keep the patients safe, not just to give you more busy work or something like that. All right, so let's see. Let me see here. Jennifer says, I'll have my husband like your page, even though he's not a CNA, if that's okay. Oh, thank you, Jennifer. That is awesome. I will take all the subscribers I can get. Will Dean says, hi, I go take my test next week. Oh, how exciting, Will Dean. Good vibes out to you. We know you're going to do fantastic. If you have not already, go to my website, foryourcna.com. It's foryourcna.com/ebook if you want to go directly to the sign up and get the PDF version of my test coaching. This will help you get ready for the written part of the exam. It's an ebook, so it's going to come to you in PDF form. This is a physical copy that I'm proofing to order some physical copies, but right now the PDF is free. So go get the PDF, and that will get you ready for the written test. But we send you lots of good vibes. Jennifer, your daughter too. Awesome. We'll get your daughter started in healthcare. And Marachi, hi. Hi, Lucy. Solomon says, I've done my exam twice and just 2 marks let me done, and I still want to be a licensed CNA because I love to be a medical. Please, what can I do? Solomon, I'm not really sure whether you took it 3 times or just twice. I'm a little confused on that. But in Florida, and I don't know where you're at, that's the other part of this, but most states allow you to have 3 attempts. If you are unsuccessful 3 times, if you failed 3 times, then you're going to have to take a state licensed program to be re-eligible to test. So I'm not real sure where you're at or whether you've had 2 attempts or 3, but there's a lot of information there that I'm missing to help you out. But your best bet is to make sure that you're going to a good reputable school that is teaching CNA the way that you're going to be tested. So feel free to watch my live classroom sessions. Those of you that are in another program, there's nothing wrong with you watching my classroom presentation. You'll probably get some things that maybe weren't covered in your class or they didn't really have time to go into detail. So there's nothing wrong with watching multiple instructors because you're going to get things a little bit differently, right? So watch the live classroom as I stream them. It will help you. You can see the replay right here. We've posted the replay of yesterday's for you right there. And let's see here. That's what makes me quite from, I don't know, lessons since last year, because I read a lot to pass. I'm not real sure, Sullivan, what exactly you're referring to, but watch our live stream. It probably will help you. Blue says, something I learned the hard way when I was young and dumb. I'm still young and dumb. There, I learned something new every day, Blue. And I tell folks today, invest in a decent pair of no-slip sneakers, the kind you wear working in a restaurant. Yes, Blue, absolutely. In fact, this is pretty interesting. One of the things in the conference that they did for us is they gave all of us a pair of their new shoes that they just are releasing. So I wore those shoes all over Vegas. And when I say we walked an average of 8 miles a day in Vegas. And I wore those shoes the whole way there, and they were fantastic. I love these shoes. And I have a bad knee. So I'm trying to get into the doctor to get something done for my knee, but that's a whole nother issue. Our healthcare system is not what it should be. But even with an injured knee and walking 8 miles a day on average, those shoes made my feet feel fantastic. So I'm actually going to bring those shoes in. I'll get the name of them and I'll pass them on to you, but they're oil resistant, they're slip resistant, they're fantastic. They got really, really good arch support. So I'll let you guys know next week what the name of the shoes are, but I highly recommend them. They're made by Infinity and they are fantastic. Go to a local scrub shop and try a pair on. Once you get them on, you're not going to want to take them off. So Priya says, I passed my clinical skills state exam. Thank you so much for helping. Oh, I'm so excited, Priya. That's awesome. Congratulations to you and welcome to healthcare. Jennifer says, have you ever heard of fig scrubs? Yes, Jennifer, I have. And, you know, my mom taught me years ago, if you don't have something nice to say about somebody, don't say anything at all. So I'm going to struggle with this a little bit. Figs is a direct-to-consumer brand. What that means is they don't sell to scrub stores. Their whole goal is to put people like me out of business. So I kind of have a problem with that because I like my business. So I have a little bit of a problem with that. I also don't like the fact that they are super expensive for a product that doesn't really have the quality to back it up. So I don't mind spending good money on good uniforms that are going to last a very long time. Like my Infinities. I have a pair of Infinity pants that I wear every single week because they're my favorites. And I have had them for 5 years. They look exactly like they looked the day I bought them. Unfortunately, I can't say the same for all the direct-to-consumer brands, Figs being one of those. So yes, I have heard of Figs, and that's all I'm going to say. So Jennifer says, just don't forget my question about the Board of Nursing. Yes, I'm going to, I'll get there in just a second, Jennifer. And Blue says, I prefer scrubs with tons of pockets. Agreed. I have to have pockets, tons of pockets. The more pockets, the better. Joanne says, I like your channel. It's informative. Jasmine passed the test. Congratulations, Jasmine. Great job. Welcome to healthcare. And Priya says, yes, I do every Monday and Wednesday. Oh, thank you. I'm so happy to hear that. My assistant posted the ebook link in the chat there, so you guys can click on that and get the ebook if you want. And it's free. You just download it. It's free. And Monica says, when I took my skills exam, I had got resident rights as a skill. Do you know how I should have done that? Resident rights isn't a skill in itself. Resident rights deals more with how you treat the patient while you're performing skills. So I'm not real sure what, what they expected you to do, but every skill for the test has a care plan that you have to follow. It has instructions. that you have to follow. So I don't know whether it was, every state handles this a little bit differently. Like in Florida, prometric states, all prometric states, they grade resident rights under something called indirect care. Other states have things a little bit structured a little bit differently. Other states may have you introduce yourself to the patient, and that gets graded for resident rights. So every state's going to handle this just a little bit different, but you would look at the instructions that you're given on the care plan and follow that exactly. So for instance, these are the care plan sets for prometric. So here we have 3 skills, and it tells you to do the skills in the order that's listed. So you have the name of the skill and then information about how to perform that skill. On the back, these are the actual checklists that you're being graded on. So prometric wouldn't tell you perform resident rights, because that doesn't make any sense. It would tell you to feed the resident who's in a chair. Now, when you're doing that skill, there's certain things that you have to do to maintain resident rights, like ask the patient what they would like first, what they would like next, offer them a clothing protector, but don't force them to wear one. We're not going to call it a bib. We're going to let the patient lead as far as pacing goes. We're not going to like shovel stuff in their mouth quickly. We're not going to use childlike feeding techniques because this is an adult. You know, those types of things. So that would all fall under resident rights as you're being graded. So Jennifer, let me go back up to what you were talking about, because this is kind of important. So according to the Oregon Board of Nursing, when you are a CNA, a certified nursing assistant, you took the test, you got your certification, you have to work in a setting that performs nursing related tasks in order to renew. And what Jennifer found out by calling the Board of Nursing is that assisted living facilities do not qualify. So what does that mean? That means that, how do I put this? When you go to renew, they're going to ask you to check a box that says you have performed CNA services for pay in this renewal cycle in order to be eligible to renew. And there's a lot of confusion about what CNA skills are, or what CNA performance is. So there's a difference between personal care and skilled care. There's a difference. Now, we tend to get this all mixed up in our head, but brushing teeth is not nursing care. You brush your own teeth every day, or you should, but that's not skilled care. You don't need special training to brush teeth. You eat every day. You don't need special training to eat. You get yourselves dressed every day. You don't need special training for that. So things that we do every day, things that are called activities of daily living. So this is bathing, dressing, grooming, eating, toileting, mobility. Those things are not considered skilled care. It's considered personal care. Now, you don't need to have any certifications to provide personal care. If your neighbor got sick and needed some help putting on their socks, you don't have to go get certified to help that neighbor put on their socks. You can just be a friendly neighbor, head over and help them put their socks on. No special training required. So personal care does not require special training. So we know that CNAs do personal care. That's a big part of what CNAs do, but that doesn't qualify under skilled care. So you would need to be doing the personal care tasks in a setting that requires skilled care. So this would be a rehab or a nursing home or even a hospital where the patients need good observation and reporting. So if you're doing vital signs, if you're emptying catheter bags, if you're doing catheter care. Those types of things are what's considered skilled care. So if you're working in assisted living and they don't require a CNA certification in assisted living, then that assisted living may not qualify you for renewal. So what would you do? What can you do? Because you want to keep your CNA. You've had it. You worked hard for it. You took the test. You want that certification. You would need to go get a part-time job, or what we call a PRN position, as needed position, in a different setting, one day a month, one day every 2 months, something like that, just to have a pay stub to show that you worked in that position. Now, I need you to understand that every state handles this different. Okay, so I'm giving you a very, very, very general answer here. Every state's going to handle this differently. There are a few states where you don't renew at all. That's not up to you. You do not renew. There's nothing you need to do. The only way that you can stay on the CNA registry is to get employed at a nursing home, period. That's the only place that qualifies, at a nursing home. And then when you're employed at the nursing home, they transmit a list to the state that says these people are working in the nursing home, they are CNAs, and you're automatically renewed. So some states, you have no involvement in this. You just go to work at a nursing home and it's automatically taken care of. Now, there are other states that you go to work in a nursing home and you have to file the paperwork, and you just check a box that says, yes, I worked as a CNA for pay in this renewal period, and they renew you. There are other states that require you submit a pay stub. It's a very murky, convoluted, confusing, inconsistent system. So in some states, hospitals count because you're working with patients with advanced medical needs. So in some states, hospitals count. In other states, home care counts. In some states, mental health counts. And then there's some states that it's only nursing homes. So you need to check with your state as far as what the requirements are. And where this gets really tricky is you have worked really, really hard to get your CNA and you don't want it to lapse. But if the only place that it's valid, that you can renew with, is a nursing home, that really limits your abilities to move around and try out new jobs. I mean, if the only place that you can work and renew is a nursing home, you're kind of stuck in a nursing home. So where this gets really, really, really confusing, and I really wish that there was a way to streamline this and to take a lot of this conversation out of it. But the real problem is that when you go look for a job, let's say you go on Indeed and you look up CNA positions, you're going to see hospitals listed. You're going to see assisted living facilities listed. You're going to see doctor's offices listed. You're going to see rehabs listed. And you're going to think, okay, I need to be a CNA to work in all of those. And it may even say in the job description, must have a CNA. But the problem is that if you have a CNA, you leave the nursing home, you go to work for the hospital because it says you needed a CNA, right? But then you can't renew that CNA because you're not working in the right setting. What is that? How does that impact your employment? So there's a lot of ambiguity here. There's a lot of gray area, and it's not always clear because you've got a lot of people involved. You've got human resources people. You've got directors of nurses. You have hospital administration, and the hospital administration may say, hey, yeah, that's a good idea. Let's make sure that all of our direct service workers are CNAs. That kind of gives us, because they're certified, kind of gives us a better image. We want CNAs. They tell the director of nurses tells human resources, hey, I'm looking to hire 4 people. They need to have their CNA. The human resources puts the ad up, and you apply. None of those people know that once you get hired, you're no longer able to renew, that because they haven't looked into it. They don't know that. So you've got a lot of people in a lot of positions that don't necessarily know all the legal aspects of what they're asking of you. So I know, I would argue that they should know. I agree with you 100%. They're in that position, they should know, but at the end of the day, most of the time they don't. So this gets really, really tricky and really, really murky, and I wish I had an answer for you, but I don't. So you need to find out from your state what settings allow you to renew, what settings meet that requirement. Go find a job in one of those settings, PRN. Just 1 day a month, 1 day every 2 months, 1 day every 6 months, work 1 shift, quit, I don't care. But make sure that you save that pay stub, because that's going to allow you to continue your certification until all of this gets worked out. This is something that I am working on in the background, is trying to give information to the state agencies and the curriculum developers for training programs at the hospital level, and I do a lot of networking and a lot of information sharing to make sure that everybody understands all the intricacies here, because it's not clear. It's not clear to pretty much anybody. And when you start crossing state lines, it gets even more unclear. So we're a mobile society now, but the laws that govern all this haven't really kept up with the mobility of our society. So it gets a little bit tricky. Hang in there. It will get better. It will. But for right now, if you want to renew, then you need to make sure that you understand the laws in your state specifically. Do what you need to do to meet that criteria so that you're able to renew and you don't get caught without a certification and have to go through it all again. I wish I had better news for you, Jennifer. So let's see here. Yeah, I mean, you can work. Yes, Jennifer, you're right. You can work as a CNA in assisted living, and they'll pay you more. They'll hire you as a resident aide and tell you, hey, go get your CNA and we'll pay you 50 cents an hour more. And you're like, yes, you go get your CNA, you start working there as a CNA, you get your 50 cents more an hour. But when it comes time to renew, it doesn't meet the needs of renewal. And the assisted living facility administrators don't know that. So it like I said, there's a disconnect between renewal requirements and employer involvement. They're not talking, they're not on the same page. So yeah, the assisted living facilities may hire you as a CNA. There's nothing wrong with that. You know how to do personal care. That's awesome. They may even pay you more as a CNA. That's awesome. But it may not allow you to renew because the state law is different than what their, what the assisted living facility is, thinks it is. Okay. Yes, you're right, Jennifer. The hospital isn't considered skilled nursing. It's acute care. It's a different category, but some states will still allow it because the care is skilled. It's an acute care setting where skilled care occurs. Okay, it's just a different classification. Don't get too wrapped up in that part of it. It's what setting am I allowed to work in order to renew. But yes, some states do allow CNAs that work in hospitals to renew. Not all. Let's see here. In Georgia, I believe it's 20 hours for the year to keep your certification current. Yeah, I don't know. I started, my assistant looked into this, and we started developing a spreadsheet to show how many hours are required, what settings are required, all of that. That's still a work in progress. We kind of got derailed because we had a couple other things come up, but we will get back to that. You're welcome, Jennifer. I have a coworker who's moving to Tennessee. I wonder what she'll find different there as far as licensing. Oh, versus Oregon. Jennifer, if your friend, a coworker, is moving to Tennessee, I would encourage her to contact Tennessee before she moves, because it is my understanding. Now, I may be wrong in this. This was told to me by 2 students. This information may be outdated and I may be wrong, but I've had 2 people tell me that Tennessee does not acknowledge any previous CNA training or certification. You have to start over from scratch. So that means that they would have to go through the entire CNA program and testing in Tennessee. So I don't know for sure whether that's still accurate, because the laws change all the time. And this was probably about 4 or 5 years ago, so that may have changed. But definitely worth checking out before you move. Let's see here. Tawana says, CNAs are now needed in all medical categories. I work in inpatient oncology floor at the hospital. Yeah, I agree. And that's where the disconnect is, Tawana. Because you've got hospitals that are saying, we want CNAs. And you've got CNAs that say we want to work at the hospital, and that's a match made in heaven. That's great. The CNAs apply at the hospital, they get hired, and life is grand. It's wonderful. The problem is that when it comes time to renew, they may not be able to renew that CNA certification, and we don't know what effect that's going to have on the job itself. Because if the hospital is requiring the CNA, but yet it doesn't qualify for renewal, then you may get in, but you won't be able to keep the job. So it's a really great area. There's a lot of legalities here. Not all of it makes sense. It certainly doesn't all make sense to me. I'm not a lawyer, but you really have to kind of check with your state to find out what the requirements are for renewal and make sure that you meet those requirements despite where you're working. Let's see here. But yes, CNAs are needed everywhere. What's interesting is that there are very few states that require certification. I'm talking about legally, right, in the state statutes. Very few states require CNA certification to work in a hospital. So they can actually hire you, train you, and put you to work. That certification is not required in a hospital setting. Most places, most states, the only place a CNA is required, that certification is required, is in nursing homes and some rehabs and some home health. Certain criteria, but those are the only legal requirements for certification. Now, like I said, employers can require something different, but there's a disconnect there. Priya says, can we take a written practice exam on Prometric website? Sure. Prometric has a practice exam for $10. It does not in any way, shape, or form reflect the test. They're taking your $10, and you're going to get a test that will probably freak you out because it's not the questions that are on the state exam. It's not even close to the questions on the state exam. And to me, it really is kind of a bait and switch. I don't like Prometric's practice exam. I'll be perfectly honest with you. There are other practice exams out there. I have one on my website where actually, it's funny that you asked this because this is actually one of the projects that I'm working on right now, is to put practice questions on a YouTube video. So I would have the question, I'm going to have the answer choices, and then feedback. And that's something that I'm currently working on right now. So we also have the question of the day. This, if you have liked any of my social media channels, so my social media channels are here. We're on Twitter, we're on Facebook, we're on Instagram, we're on Pinterest, of course YouTube, which is where we're at now. On most of those, I have the question of the day. And every day we post a question with 4 answer choices, and you can figure out what you want to choose for the answer, and then it's going to give you that feedback for you to see if you're correct. So this is, you can go back and look at these in the past. I've got a video that's coming with a lot of practice questions. And then on my main website, foryourcna.com, we have a practice test on there for you as well. Now, our online program has literally thousands of questions that I have written. in the online programs. So if you haven't taken a look at that, you might want to take a look at that as well. But yes, Prometric also has a practice test on their website, but it's not the same scope of questions. It's not the same type of questions, and they're not written the same way as the state exams. So just be careful about, using that one to prepare. Blue says, oh, Patti, that reminds me, I so need to email you the laws here in Washington. HCAs can work in assisted living facility doing CNA tasks, but can't do the same task in a nursing home. Yes, Blue, because legally you must be certified to work in a nursing home. Now, this all has to do with staffing. And this is back in the 80s that this happened, but this is all due to staffing. Because in a nursing home, you may only have 1 or 2 nurses, actual licensed nurses, on staff at any given time. And the rest of the people there are just workers, right? So because there was very little oversight, that's where that CNA came from. It was a way of certifying these individuals to work, to show that they had minimum skill level achievement so that they could work predominantly unsupervised in a nursing home setting. So skilled care, right? Higher level of care, predominantly unsupervised. So when you're working in a hospital, there's a whole lot more nurses around. When you're working in rehab, there's a whole lot more medical people around. When you're working in mental health, there's a whole lot more medical people around. When you're working in a doctor's office, you have ready access to the doctor because you're not there by yourself. So because nursing homes are sparsely staffed with licensed individuals, that's why we needed that additional level of assurance. And that's why that law exists, Blue. Jennifer says she already got certified for Tennessee. Yay, good. She didn't mention having to start over again. Awesome. So that's good. That means that they may have re-evaluated that process. That's good. Blue says, oh, that reminds me, Washington State does CNAs weird at the hospital level. I just made a note to send you an email. Yeah, Blue, send me an email on that. And Mai just put a link in the chat for our Instagram account. So make sure you follow us on there for the daily questions. And I'm looking at a way of making the questions on the video that I'm making for the questions on YouTube interactive. So how cool would this be? Okay. So you're watching, you want to do some practice questions. You pull up a video on YouTube. I give you the question, I talk about it, probably something like this where you've got, right over here, you've got the question, and then I ask you to select an answer, and the video pauses, and you get 4 options, and you select one, and then it'll tell you whether you're right or wrong, but it's a video. How cool would that be? So that's something that I'm looking at implementing. The software is pretty pricey. It doesn't work on all platforms, so I'm still evaluating to figure out whether this is something that I can do. But my goal is to have these practice questions on YouTube in a bit more interactive format to make it a little bit more fun. So yeah, we'll see if I can get it. If I can get it working, I'll let you guys know, and you can take a look at it for me and let me know what you think before we publish it to the main public. I'll use you guys as my beta testers. How's that? All right. Priya says, can we take a written practice exam on Prometric? Yes, Priya, you can. There is a practice test on Prometric. It is not accurate as far as what to expect on the state exam, but yes, you can take a practice test on Prometric. We have one too. Ours is free. Prometric charges you. Ours is free. Crow's Nest is such a cool idea. Well, thank you. Yeah, I'm super excited about that project. It seems like it's going to be a lot of fun. I'll keep you posted. All right, guys, so let's see who passed over the last 2 weeks, because I didn't get a chance to congratulate you guys last week. But these people came by our channel and dropped us a comment somewhere, either on a video or through email or something like that, and let us know that they passed. So let's congratulate Danielle Webb, Colin Wojo, Ada Naya, Mara Ledger, and Soda Pop. So congratulations to all of you. Great job. We're super proud, and we'd love to welcome you to healthcare. So great job. And if you've passed a state exam, let us know. Go to any of my videos, drop me a fresh comment. Don't put a reply on somebody else's. I don't always see those. But put a fresh comment. Let me know that you passed so we can congratulate you on an upcoming episode as well. And we do have 2 people that are waiting on results. They have tested. They're just sitting by their mailbox with their fingers crossed, waiting on those results. And we're going to give them lots of good vibes as they wait. And peanuts are cheap. And Janiyah Johnson are both waiting for their results. So congratulations on taking the test. We're going to keep our fingers crossed and send you tons of good vibes, but we know you did fantastic. Please stop by and let us know what your results were so we can congratulate you as well. All right, guys, we are officially out of time. I'm so sorry, but stay tuned. Next week, we'll have another lesson for you right here on our YouTube channel. It's For Your CNA, the app For Your CNA. We're super easy to find. If you haven't liked and subscribed, please do so. And if you've got some questions for me, save them till next week. I'll be happy to answer them. I'll have a pretty cool presentation for you next week as well, so make sure you tune in to see what we're going to be talking about then. All right, guys, until next time, happy caregiving. Bye.